live, Doc.
Hello, everybody. Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. It's the time I get to spend with you guys and answer all of your yearning, burning plastic surgery questions. Okay. And today I got an important topic. It's a short topic, but we'll start with that. We're going to talk about gluteal fillers, i.e. butt fillers, okay? And then, of course, I'll be happy to get into all of your questions regarding any plastic surgery topic from head to toe, okay? But why is this coming up? Well, you all may have heard of that influencer. I don't recall exactly her name, but she wanted to look a lot like Kim K. She had multiple surgeries, and she decided to have to get more volume into her buttock. But because she didn't have any fat, she went to some lady whom we don't know, not a doctor, to some room in some hotel, and she got some fillers placed, and then she died. Okay, so a real tragedy there. And the lady, I think this was in New York. Somehow she ended up in Florida, and they arrested her here for manslaughter, which is actually incredibly, it's incredible, severe penalty there. But she was practicing without a license, not a doctor. Okay, so that's manslaughter, that's murder almost. Okay, so let's talk about gluteal fillers, because we do get asked this question a lot. Like, well, doc, if I don't have fat, what else can I do? Are there other options and things like that? And so I'm going to tell you about what is out there, and I'll tell you what is not a good idea, okay? And then what really the only other, kind of options there are, okay? So what are the most common things that you see where you're having like these butt fillers that are done in some hotel room, in some motel or some garage or somebody's kitchen? Those are basically, we can just kind of label them as biopolymers, okay? And so these are placed into the buttock, and they're used to expand the buttock and give more volume, okay? However, the problem with these biopolymers is that they never go away, they never get absorbed, and they are identified by your body as a foreign substance. So they are a big issue. All right, this is one of the things that I definitely do not recommend. And of course, definitely don't do it with somebody who's not a physician, someone who doesn't have a medical license and who's practicing out of like some garage, okay? That's just, just a surefire way to either, get killed or get a horrible complication, okay? Because what happens with these biopolymers? So your body essentially rejects them, okay? In the best of cases, your body just, you didn't get a rip-roaring infection, but your body rejects them and it forms this huge inflammatory response around the area. Sometimes we call that like a granulomatous response. And so then you have these chronic issues with inflammation. You have chronic, sometimes open seeping wounds as well. Chronic pain can happen. All right, and so that's the best case scenario, okay? In the worst case scenario, these get infected. You can have multiple chronic abscesses to the area, basically open wounds that weep for months and months and months, if not years. And the thing about this is that you can have your biopolymer placed and actually maybe perhaps be okay for 2, 3, maybe 5 years, and all of a sudden it'll get you. And here's the thing, it will always get you 100% of the time. Okay, so, and then in the worst case scenario, is similarly how you can have potentially a pulmonary fat embolism. You can have an embolism from these biopolymers, and then you can have pretty much instant death as well. Okay, you have someone who's not a physician, someone who's not trained. They really have no idea what they're sticking that cannula or that needle into. They know nothing about the different layers of the buttock. Like we discuss here so often, the skin, the subcutaneous fat layer, which is that safe zone. Then you have your muscle, and then the deep to the muscle where you have the large vessels. Muscle and deep to that is unsafe. Okay, you have someone just jamming this stuff in there. They're gonna get one of those major vessels, one of those superior inferior gluteal vessels, and there you're gonna have an embolus of biopolymers, and that's gonna be essentially instant death. Okay. So do not do this, please. Do not do this. If you can't afford sculpture or fat, then save up okay? But it's not worth your life. This will either give you extremely poor quality of life or potentially death, okay? So biopolymers, no, don't do that, okay? The next one is silicone, also a terrible idea, all right? Silicone that is placed kind of like as an injection, as kind of a liquid, does not work well. Do not think of it the same as a buttock implant or a breast implant, right? A buttock or breast implant, kind of like here, has this tough shell, right? Tough shell around the implant. This shell's super tough, all right? Sometimes if you really try, you can rip it open. But you know, you got.
You're strong.
You know, I know. Took my vitamins today. But it has these shells where that silicone is not going all over your body, okay? But if you're just injecting it into the tissues, your body's not going to react well to it again. It is going to identify it as something foreign and create some of that kind of granulomatous response. And we've seen this sometimes when we're doing some liposuction or doing a BBL. We'll see like the little kind of pellets, so they look like little pellets of silicone. There's inflammation all around the area. The tissue becomes very hard, very stiff. It does not feel natural at all when it's put in that manner. And also part of the problem is that it's also done a lot in like garages and you know, whatever, in the motel, in the garage, in the kitchen. And so they're not even using medical grade silicone, which is what you find in your implants. They're using what they call like industrial grade silicone, something they can get off of Home Depot, which is, of course is very, very bad. Not meant to be inside your body. So again, you're gonna have the same problems with the chronic inflammation, infection, okay, and if they put it in too deep, okay, again, an embolus and sudden death. So definitely I do not recommend this, okay? So now we get into some of the stuff that we do recommend, and I did forget one here as well. For those, you know, skinnier patients, you also have your buttock implants, okay? Which do exist. But if you have a small area, so you have just a little small area that needs just a little extra fill, say for example, you had your BBL already, there's not a lot of fat left, but there's just this one area that you want to touch up, then Sculptra is a great option. And this one is FDA approved as a filler for the buttock, okay? So if you need to fill just a small area, this is the one that I recommend. Because you don't need to, you know, potentially do any liposuction. Perhaps you don't have a lot of fat left. Perhaps you don't have a lot of downtime. You don't want to go through the whole ordeal getting into the operating room. And so Sculptra is something that we do right here in the clinic. It can be done in the aesthetic center. So our PA, Natalie, who you've hopefully met by now, and our nurse practitioner, Jenny, they can do the Sculptra for you. And it's pretty much one of these kind of lunchtime type procedures where you can come in, you know, 30 minutes to an hour, depending how many areas. Get your Sculptra and you're good to go. Pretty much no downtime for that. But here's the caveat. It's only for small areas. So you can't do like a full BBL with Sculptra. Do not think about, you know, that you could do that. It's only to go for very small targeted areas. And also it does not last forever. Okay, so the max that it typically lasts is about 2 years. In order to really get the best result, you do need multiple treatments. Typically recommend 2 to 3 treatments of the Sculptra, and then after that it should last for about 2 years. Okay, also there's of course there are some costs involved with that. The cost is similar to like say an injection of fillers for the face. Alright, but if you have a small area, don't want any downtime, that's a good option. Of course the best option is your own fat. Okay, we talk about this all day, which is your gluteal fat transfer, i.e. your BBL, Brazilian butt lift, or your SO BBL, your South Beach butt lift, skinny BBL, etc. Okay? Really, that is the best option. The best gluteal filler out there is your own fat. So if you're a little bit on the skinny side, I would say gain some weight. Gain some weight for the procedure so that we can use your own fat. Okay? Because it is, you know, it has the best result, the most natural feeling result. It has the longest lasting result. It is your own fat, so your body's not going to reject it, okay? And so once that fat takes and everything settles, it's there for life. So it's basically a one-time procedure, okay? unless you're coming back because you want another round 2 because there's some butt greed there, right? All right, we see that as well. Okay, but fat is the best option here. Of course, your BBL. Now, if you do want some volume and you're thin and you don't think you can gain the weight, because for some people it can be very, very tough. They just have like high metabolism. Then buttock implants are an option. Okay. Now, when you do this, just be very well informed about who's doing it. Number one, because you need someone who has quite a bit of experience with this procedure. It's not like a simple, like super straightforward procedure. I would definitely go to like a board certified plastic surgeon who has a lot of experience with placing the buttock implants. Nowadays, the tendency is to use implants that are not so big, okay? Because we noticed that when you had large buttock implants, it led to problems in the future. It led to like malposition, where the implants move around and then the shape changes. Of course, infection rates are somewhat high because you have to place the implant through an incision that's very close to the anus, which has a lot of bacteria, and therefore you're placing this foreign body into the buttock in an area that's not super clean, and so it can have issues with infection. And if the buttock implant gets infected, then it needs to get removed. Okay, and then of course they just don't last as long as say breast implants because you're sitting on them all the time, right? You're putting pressure on this implant all the time, as opposed to the breast, which of course that's not happening there. And so, a lot of times you can run into issues kind of, a few years down the line in terms of implant rupture or having to change the implants or things like that. So if you do a buttock implant, it is an option. I would definitely advise against going too big with your buttock implant. And some of the best results that we see nowadays are when you place the implant, like a moderate size implant, and then with whatever little fat that you have, and then you use that fat to kind of infiltrate around the implant. Okay, because one of the things that buttock implants cannot do, they don't do hip dips, right? Buttock implants are for the buttock itself. There's no such thing as a hip dip implant. Okay, so sometimes you can combine it. If you say you only have 1,000 cc's of fat, not enough to get you the projection that you want plus the hip dips, then you can use a buttock implant to give you some more of that projection, and then use 500 cc's of fat to either side to kind of smooth things out and fill out the hip dips. And that's kind of the combinations that we're seeing nowadays. Now, me personally, I don't do buttock implants because of all the issues that we just discussed, but there are surgeons out there that have a lot of experience with this, and that's who I would look for, someone who has a lot of experience with it and who combines it with fat transfer. Okay.
Can you use the sculpture to fill in the hip dips?
Yeah, so you can use sculpture to fill in the hip dips. Again.
And how long does that last?
They can't be severe, right? If you have mild hip dips, then I think the sculpture will work. Remember, you're probably going to need, I would say, for most patients, 4 vials per side. Okay. And then, of course, you have to do that at least twice, maybe 3 times. So the cost can add up. And then remember that, typically it lasts for about 2 years, okay? So after 2 years, you may have to do it again. Now, what I can tell you is when you come back at the 2-year mark, typically that you might need less vials at that point in time. So say you started, just to say a number, 6 vials per side. When you come back in 2 years, maybe you only need 4 vials per side, okay?
Mm-hmm. Dr. Alex, I'm coming there on 8/29 to get my tummy tuck and breast lift. But I also take Wegovy shots. Do I stop before my surgery?
Yeah, so that's a great question. So first of all, what is Wegovy? So Wegovy is one of these newer medications out there, these newer injectables that are used for weight loss, okay? And so they're called, GLP agonists because they act like glucagon, which is something that we have in our body. And so what they do is that they help you feel full faster, and they also delay the emptying of the stomach. And because of that, then you eat less and you lose weight. So they're really, really great. I'm super excited about these products. Actually, we're offering semaglutide here at Pure in the Aesthetic Center. So if you're interested in that, please give us a call. However, you do have to be careful in terms of surgery because of what I just mentioned. Because it does delay the gastric emptying, and we need to have an empty stomach before you undergo general anesthesia, we do need to stop the Wegovy or the similar shots at least 2 weeks before surgery. Okay, so if you stop it 2 weeks before surgery, and then that way your gastric motility comes back into play, and therefore when we say that you have to be, NPO, meaning without eating or drinking 8 hours before surgery, that's going to be enough time for your stomach to empty.
Thank you very much. Quick question about BBL versus skinny BBL. What's the difference?
Yeah, so BBL, your Brazilian butt lift, and then you have your skinny BBL. Really, the difference there is the BMI of the patient, so where you're starting from, and also B, kind of where you want to end up. All right, so a skinny BBL is typically a lower BMI patient, so I would say BMI somewhere between 20 and say 24 max. They typically don't have the 4 liters of fat, but they'll have at least 2 liters of fat to remove. And then the goal is not for a very kind of Vixen type shape. Otherwise, the goal is more for like an enhanced natural shape. Okay, and so that's really like the difference there between your run-of-the-mill BBL and then your South Beach butt lift or skinny BBL.
Thank you. We got a lot of questions about just hip dips and our options here. So a lot of people who have booties, a lot of us have booties, but lack hip dips. What is the best option if you just want to come in and fill the hip dips?
Right, so the best option is still fat.
Okay.
Okay, that's still going to be the best option. And I'll tell you what's not a good option. Obviously, don't do that. I already talked about that. But this is one of the things that drives me a little crazy. You hear like all these, people on social media, fitness gurus or whatever, and they're like, work out to fill your hip dips. That does not work. Okay, do not fall for that. Why is that? The hip dips, is actually something called a trochanteric depression, which means that there's an area that comes in, and in that area there are no muscles. There's no muscle there, okay? So you cannot work it out. You can't build a hip dip, okay, with muscle. So don't fall for that. The only way to fill out a hip dip is by giving it volume, and the best volume to give is your own fat.
Thank you. Quick question about hip dips again. So if I just wanted to get sculpture in my hip dips, how long would that last?
So like I said, it's going to last probably about 2 years. And you'll need, we recommend more than one treatment initially. So you'll have your first treatment, you come back about a month later for your second treatment, and then we'll see some patients may require a third treatment just to get to where you want to be. And once you get to that place, it should be good for at least 2 years. But then at the 2-year mark, you may need to come back for another treatment.
Iron regimen. Can we talk about when to start and stop?
Yes, certainly. So we do recommend that all our patients be on an iron regimen prior to surgery. And so what does that mean? So we recommend something called Hemoplex, or Floradix. These are two of the ones that we recommend. You want to start doing this at least 30 days before surgery, but you can start sooner if you like. We always give you your pre-op call somewhere between 45 to 60 days before surgery, and at that point in time, we talk to you about the iron regimen, and that's when you can get started, okay? The iron regimen is not just the iron supplements, but it also includes vitamin C and folic acid, because these help your body with the absorption of iron.
Thank you. You answered the next question with that. The sculpture, fat transfer, and the implants. Do you offer these 3 things at Pure Plastic Surgery?
So at Pure Plastic Surgery, we offer these 2. Okay. So these are the ones we have here at Pure. All right. But we don't do buttock implants. Neither myself nor Dr. Vidal.
Is there a reason why you don't choose buttock implants?
Yeah, so the reason is, because there's potentially a lot of complications with it. And so, the risk of infection is a bit higher, again, because of how you have to place the buttock implant. You have to make an incision that's near the anus, which has a lot of bacteria. Therefore, it's not completely clean or sterile area, and so the risk of infection is higher. And if these implants get infected, then they need to be removed. The other issue is that long-term longevity, right? This is an implant you're always constantly putting pressure on, and so that can lead to implant rupture or the implant, kind of moving and being displaced. And so a lot of times these implants end up, getting removed, years down the line. So it's really not my preferred way of building the buttock or building the hips. I think fat is really the number one way to do it. Now, like I said, are there going to be exceptions? Yeah, there are going to be, very thin patients that don't have enough fat, that are not able to gain the weight, and so they're really then left out of options, and so the buttock implant really becomes the only option. And then, I would refer you to one of my colleagues that performs the surgery.
Thank you. Next question. How long after breast reduction will you do an ETT?
So, well, we can combine the breast reduction and the extended tummy tuck. So ETT stands for extended tummy tuck. And a lot of times we can combine those two and do it at the same time. And that would actually be my recommendation. So if you're coming in for your breast reduction and you're thinking about your extended tummy tuck, then you just do them all in the same day, the same surgical setting, okay? But if you do need to separate them out for whatever reason, maybe your breast reduction, you have such large breasts that the reduction is actually being covered by insurance, and your extended tummy tuck is not, then I would separate them out by at least 3 months.
Thank you very much. How long after having a baby is it safe to have surgery?
So you want to wait at least 6 months, pretty much for any surgery, okay? You want to wait 6 months. You want to make sure that your body starts to get back to its kind of pre-pregnancy state, okay? You want to make sure that the hormones all kind of start to kind of balance out into their pre-pregnancy state as well. And so we don't recommend doing any surgery before 6 months, okay? That's whether you gave birth via C-section or natural. And then the next thing is, well, what if you're having a breast surgery? So with that, we have to be careful as to breastfeeding, right? So you want to wait at least 6 months after you stopped breastfeeding for a breast surgery, okay? We want to make sure that all those little ducts, all those milk ducts are completely closed before we undergo a breast surgery to minimize risk of infection.
That's perfect, because this next question, she wants a breast dog and a BBL, but not sure what to do first. Does it matter what you do first?
So between a breast dog and a BBL, it doesn't really matter what you do first. You can choose whatever, that's up to you. I definitely don't recommend doing them at the same time. So it's good that you want to separate them out. And you can separate them out by at least 3 months. So whichever you do first. You can do your breast dog, 3 months later your BBL, or if you like, you can do your BBL, 3 months later the breast dog. If you ask me personally how I would do it, I would probably do the BBL first and then the breast dog, because we can take that opportunity when you're doing the breast dog to perhaps do any little touch-ups that need to be done to the BBL, which is not uncommon.
Hello, Dr. Earl. You did my BBL and now I'm out of state, and now I want to schedule my mommy makeover, but I know that I need to stay 5 to 7 days post-op. Yeah. What's the situation with the recovery house in Miami? Do you suggest doing that?
So, there's multiple options for recovery houses here in Miami, and unfortunately, you're correct. They're not all good, right? Some are much better than others. Some of them can be like complete scams. So you do have to be careful. So my recommendation is to definitely do your research. But what I would recommend, if you're, because you've been with us and you're coming here, is to join our Facebook group, okay? So we have a Facebook group called Earl's Pearls Community, where there's a lot of patients there who've had surgery with us in the past, who have stayed at, several of the places down here in Miami, and you can get some recommendations directly from them as to where they stayed and how they did. And that would be, definitely a good place to start. And then after that, of course, I would continue doing my research on the recovery house in terms of who owns it, who's going to be taking care of you, is it going to be an actual nurse? If it is a nurse, check on her license, make sure she's registered and that her license is active.
Thank you very much. For the last question, when getting a tummy tuck with muscle repair, do you do the lipo before or after the muscle repair?
So for most cases, I typically do the lipo after the muscle repair, but honestly, not always. It really depends on the case. There are some cases where I start with the liposuction because I feel like they have quite a significant amount of fat, and I really want to kind of reduce that and start contouring the body before I even make my incision and continue with the tummy tuck and then the muscle repair. And then there's other cases where, you know, I already I see the shape coming out. I want to just go ahead, make the incision, do the muscle repair, then do the liposuction, and then, of course, remove the excess skin and close.
Thank you very much.
All right, that's it. 30 minutes already?
Yeah, Wednesday, one more. Did you watch the Kentucky Derby?
No, I missed it. I missed it.
Your love for horses.
I know. But I think this year, for some reason, I think it was this year. Yeah, this year the Kentucky Derby was at the same time the Formula One here in Miami. So you guys may have seen like the short little video I did, but I ended up going to Formula One this year. So no, I hope you enjoy the Kentucky Derby. Maybe even go to the Kentucky Derby. That would be so awesome next year.
Somebody said, so you chose car racing over horse racing. I like it.
Yeah. I did for this year, but it might not be every year. Yeah.
All right. Thank you very much.
Okay, guys. All right. Well, this has been great. I hope this was helpful, guys. Please, 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 please do not do the biopolymers. Do not do the silicone to the buttock. Okay. It's just gonna end up very, very bad. Okay. Public service announcement there. Go with these 3 options. Sculptra, fat, #1 option right here. And if you have no other options, then the buttock implants. Okay. All right. And I look forward to seeing you guys.